Good afternoon, everyone. I'm Dr. Lisa Tartaglia.
I'm Dr. Sarah Bohn. Welcome back to Yodo.
We're here today to do a channel update for 2023.
It's been a little while since we've been able to be together.
It sure has. I'm so happy to be back.
I'm really glad to have her back.
Thank you so much for holding down the channel in my absence.
She's been really busy with a lot of things. Now, you know that I have a hospice and palliative job that's a full-time job that I go to every day and work, and then I do the channel as extra stuff. But Dr. Tartaglia splits her time about 4, 5, or 6 different ways, I think.
I have three paying jobs. I've worked for CVS Minute Clinic as a medical director since 2009. So I cover several clinics down in South Florida. I also have my business, which is Promessa Medical Consultants, that currently I'm working Mondays and Fridays with that. And then I recently took on a position in July, starting with Orlando College of Osteopathic Medicine. So I've been extremely busy. I'm in a different season of life than Dr. Bohn. I have 2 younger children that kind of still need me around. Mm-hmm. So when I'm not working, I'm the Uber driver, I'm the chef, I'm the cleaner and the dishwasher and everything in between.
So she keeps busy, and it keeps her out of trouble.
Yes.
Or maybe it puts her into trouble. I don't know. But at any rate, we're really glad to be able to be back together today. And this is a channel update, kind of where we've been, what we've talked about, our goals for the channel. So we want to talk with you guys about some of those things. Our goals for the channel is we want to be able to provide information. Life is finite. Death is a normal part of the life cycle, and we want to be able to help normalize that and help provide information for people, because it's necessary for you guys to be able to have that information to be able to make appropriate decisions.
As hospice and palliative medicine physicians, we have very, really strong feelings on how end of life should be met. And we feel that it's really important to have those difficult conversations with your loved ones while you're well, so we can prepare for your future.
If death is a normal part of living, as we say, why not be prepared for that and make choices that you can? We all make choices every day that have to fall within certain constraints, whether that's choices with our family, choices with our groceries, choices about our home or our automobile. We have constraints around those choices, and healthcare is no different. There are truths with our healthcare, and we have to be able to have enough information to make decisions that are appropriate for us. And that's what we want to help you see, that you can help yourself, help your family make appropriate choices.
We find that when we're caring for patients at their time of need, at their time of distress, it's very difficult to make these choices. So that's why we envision this channel to be very informative for you to tune in and listen if it pertains to you, and have you have all the information you need to make correct decisions for yourself. And it's an individual decision. Not everybody's decisions are the same. Just like everybody that may like coffee, not everyone likes their coffee the same.
Mm-hmm. These decisions that you make are what's appropriate for you. So there's not really a wrong answer, but it's what's right for you. Obviously, this channel is for patients and for families, but we also want to provide information for healthcare staff.
Yes, it's really important to educate all healthcare staff. I can't tell you, I've been doing end-of-life care for almost 20 years now, and sometimes I'm taken aback by even hospice staff and what they are saying to the family, that they still don't really have a concept of what death and dying looks like, or their perception of what is going to happen is really not the truth, and they're sending that off to patients and families.
Certainly the channel is also for the providers of that care, whether it's RN staff, aide staff, nurse practitioners, physicians. We want them to have insight into this hospice and palliative world, into the world of the end of life. This is kind of the ugly side of medicine, but it can be a beautiful thing. We're all going to face the end of life, so why not have it go the best way we can? Have understanding, acceptance, and have that compassion and kindness that we all want to have at the end of life.
Yes, and really emphasize the empathy that we need to have to the patients and the families that are really faced with these difficult decisions. We generally, you and I, live life to the fullest, and we know how important life is, but most people don't. They're in the mundane day-to-day, and sometimes I fall that way too, right, with all my jobs and all my tasks. But I always reflect when things happen to me or events that occur in my life that I'm going to learn from them. I'm going to help my patients and families if it pertains to medicine and make them have better choices.
Agreed. What we hope we can teach and the why that we hope we teach that is not necessarily because we want to be Dr. Doom and Dr. Gloom.
No. We really want to be Dr. Truth and Dr. Honesty.
Yeah. We want people to have hope. We both believe that hope should never die. Hope should always be alive. And by living, I mean it should be allowed to change. What you hope for when you're 3 is not the same thing you hope for when you're 12. It's not the same thing you hope for when you're 21 or when you're 35 or when you're 65. So we want hope to be alive and hope to be allowed to change.
And I think that the important point that Dr. Bohn makes is that we allow it to change. I think that's where a lot of families and patients get stuck. They want to stay where they were, and it's just a normal evolution of life.
And if we're allowed to be Dr. Truth and Dr. Honesty, we want to frame the information that we have. Maybe it's bad information, but we want to frame that information so you know what you're up against and you can prepare for the kind of future that you want to have.
Yes, why would you want to navigate healthcare system through fear? And that's unfortunately what has happened in the evolution of medicine, that doctors have limited time with their patients. We have a lot of mid-level providers, nurse practitioners, physicians assistants assisting us with the care that may not have the knowledge base that we have. And you really just want to be able to take the time to speak with your patients, to be honest and truthful. So then they're able to make decisions for themselves. And not every decision we're going to agree with, right?
Correct. But that's what's best for you. And that's why it's so important for the patient to talk to their healthcare surrogate about what their choices are and what's meaningful to them. Because you don't want to be painted into some corner over time with healthcare treatments and you're thinking about it sometime, you're thinking, how did I ever get here? And now I don't know how to get out of this. So communicating that information to your healthcare surrogate about what's important to you, what quality of life means to you, gives them the information that they have need of so that when time comes, they can help guide you, or if needed, they can make those tough decisions on your behalf. They can tell others, this is what they would have wanted. They told me this is what they wanted. It may not be what I want for them, but my responsibility now is to make sure they get what they chose. And this is what they told me they wanted.
Mm-hmm. And this responsibility is a selfless responsibility. What Dr. Bohn is speaking of, it's not what you want, it's what the patient had want if they were able to make decisions on their own. This is when a healthcare surrogate takes over. It's when the patient is no longer able to make decisions. So you really should start having those conversations whenever you're diagnosed with a chronic illness, especially if you're going in and out of hospital setting or having to go to doctor's offices more frequently for symptom management or different illnesses. This is the time to have those conversations.
And no kidding, the healthcare surrogate position, yes, there's a lot of burden involved with that, but what a position it is of honor. Mm-hmm. That this person trusted you more than anyone else to represent their goals and represent their wishes. So I think those are things that, everybody should talk about periodically and review with their family periodically. Just like every February you change the battery in your smoke detector, mm-hmm. just on a routine. I think it's important if important concepts come up or something is in the news and it makes you think about what quality of life means to you and somehow that's changed, you need to let your family know.
Yeah, and I think what Dr. Bohn is saying is very important. And just to add, you should also let other family members know, not just the healthcare surrogate. It's kind of nice to let everyone know. For some reason, it's almost like a taboo. Mm-hmm. They'll be like, well, my daughter's the healthcare surrogate. She's in California or whatever, wherever they are. They're not there, but she's this healthcare surrogate. And then no one else knows. Everyone should know, right. Because then it will make that decision feel a little bit lighter for that healthcare surrogate
right.
to make.
Right. And if talking about taboo topics makes them happen, then I should have won the lottery. Because I talk about it all the time, and I've not won it yet. So don't be afraid
yes.
to talk about these difficult things that are taboo, that you're afraid of, because I just don't think that's going to make it happen. You need to be prepared, and that's the best way to be prepared.
We really wanted to do this video as an update also to thank everyone. We had a great first year. We've gotten a lot of views on our channel. A lot of people subscribe, and we really appreciate it. We love the conversation that we have with our viewers, with the emails that we've received. I've had some conversations with people on the Google Meet platform. Dr. Bohn has been talking to them through email. It's been really fun.
We have some interaction with a few loyal followers that almost always leave us a comment, and I'm ever so grateful for that. We've had a couple of people reach out to us on LinkedIn or through Facebook. So people are finding ways to reach us, and I'm ever so grateful for that. We didn't start this channel to go viral. We certainly don't make any money on it. This is, like we've had to, buy all the equipment to make these videos, and we do spend time putting these things together so that we try to give you the most accurate information. In a few years it may not be accurate because healthcare does change.
Right.
So we didn't do this for fame or notoriety. We did this because we want to provide that information to you.
Yeah, we did this because we're passionate physicians. That no matter how hard our days are, and no matter how beat up we get with our healthcare systems that are so broken, we are not going to allow them to break us. And we feel that it is very important to tell you, our viewers, our point of view, because we're around death and dying, and we want to make it lighter because we see the strain that is put on and these patients and families, and it's very sad that they go through this. We also feel like if you look at our channel and you might say, oh, you know what, my neighbor is going through something like this, forward our video to our neighbor. We'll be happy to even make the time to talk to your neighbor, to your friends. We want our videos to be out there for everyone, and we plan on changing them as things evolve in medicine.
But we want it to be there for you on your timetable, so you can watch it in a more comfortable environment than in a sterile hospital room with everybody wearing a mask, because some hospitals are still masking in some areas, and viral infections are still worrisome. We want you to be able to have this information so you can watch it and review it at your leisure and in a more comfortable environment.
Yeah, and we really appreciate the viewers that have given us a lot of questions, comments, and suggestions. I find it so humbling to get to speak with our viewers and try to help them navigate this very difficult time, and it's just wonderful to have that connection.
I appreciate that very much. We do have empathy in our heart, and we feel sorry for anyone who has to watch our videos because they're facing these types of things. But we want to provide that honesty, and we want to provide that knowledge that dignity is available for those people to have that comfort that they need at end of life.
Yeah, we feel like this information you should have access to. It shouldn't be in an ICU room while your loved one is hooked up to every machine, and you're getting, it's a Friday afternoon and they want to figure out how they can
and
get
you're
that
bombarded with emotions and information, and they're drowning you with numbers and test results, and you just feel like you're not even sure how to proceed. How do I go forward from here? If that happens to you, tell them, I need to speak to your palliative physician. Most every hospital now has a palliative physician available, or a palliative service for consultation, and they're going to take more time with you than possibly your hospitalist, your internist, or your pulmonologist that's managing the ventilator. They may not have that time to spend with you that the palliative specialist will.
Yeah, the difference is the palliative specialist is the global specialist. We look at all systems, all body parts, and we can look at things in a global perspective and then identify and prognosticate based on the findings that we see. Unfortunately, when you're dealing with all the specialists, they're only going to talk about their system, and doing so, sometimes they might use words that are very confusing, like stable or things are okay.
I have a good test result.
Yes, but you're not looking.
One test result?
And there's 100 other that are not great.
They want to provide information for you that sounds hopeful, but sometimes they mislead you. It's information that you absolutely have a right to, and you should be able to access the information. Many healthcare systems now, you can access the information online, but having that palliative specialist that you can communicate with, they'll help you interpret what that information really means.
Yeah, and I will say sometimes having that access online is detrimental to families. We had a viewer reach out to me that did get information online for their loved one, and then was unable to get a follow-up.
Oh, wow.
with their healthcare system. So just know that if you do get lab values or things that are out of sorts, could definitely contact your healthcare team immediately and then ask if you're concerned if things do not look well. Like Dr. Bohn said, even on an outpatient setting, you could do a palliative consult virtually, and some even make home-based palliative visits.
We want you to have good health. We want you to live life to the fullest and with as few regrets as possible about your quality of life. And having information about your health care, where you're headed with your disease state, what stage your illness is at, is going to help provide you that guidance that you need to make the appropriate decisions that are right for you.
And we really think that you shouldn't avoid the taboo topics. And the taboo topic of our day is death and dying. Family has a right to have the information. The patients have a right to be able to have an opinion in their disease trajectory, and you need to know when it's time to make decisions.
I want to point out that Dr. Tartaglia is licensed in several states, and she does do palliative care consultations. She can be a really good resource for you if you're having a need, and you can reach out to her either through our email or by dropping a comment below. Don't leave any personal information or data or phone numbers or anything there, but if you're in need of it, drop a comment. I'm going to send you an email. Send us an email if you have a need, and see if it's one of the states that she practices in.
Thank you for the plug.
You're welcome.
We also want to give credit and thanks to so many who's taught us medicine, from our patients to our teachers to anyone.
Our
family. Yes, that's true, especially to our family. Our families have a way, especially our children, of putting life in perspective, and for helping us make this channel for you. Because a lot of times we just think, we go through life the way we are, and this is like natural, kind of like tying our shoes, and we forget that we do have some magic.
I had a resident recently that pointed out to me that that's part of the curse of knowledge. Once you know something, it's hard for you to understand the concepts anymore of the things that you didn't understand. And so when someone approaches you and they don't understand about death and dying like we do, then we kind of have to back up and remember that they may not have had the experiences that we have had.
Yeah. Sometimes I have to back up, stop, take a breath, because I just want to give the knowledge.
Yeah.
And sometimes people aren't ready.
They're not ready for it all.
We are grateful for those who inspire us along our quest for us to be able to provide you information and care.
We appreciate the special guests that have allowed us to interview them and provide their perspective. And we do have other interviews that are planned for this coming year. We've got more videos planned for this coming year.
Yes, and without further ado, we must give special thanks to Bohn Human, who really believed in us. She is a fantastic YouTuber. She helped us on this platform. She's been our guiding light, and is always our cheerleader in the background, and we are so grateful for all the time and energy she's put in this channel.
She's helped us with preparing the channel, teaching us the editing, loading things onto the YouTube channel. So she's helped keep us legal and helped keep us going. So thank you very much, Auburn.
We want to thank you so much for joining us today, and it was so great to be back, Dr. Bohn. Thank you.
You bet. I'm glad to have her back. Thanks for watching, and we'll see you next time.
Bye.
Bye.